Now kindly restart. Thank you.
Good evening to one and all present over here. Homeovision has started with this series of webinar, and it is organized by All India Homeopathic Student and Youth Association. So today we are going to hear from Dr. Yogesh Niturkar sir on a very important topic, that is importance of case reports in homeopathy. Let me introduce our speaker. So we have with us Dr. Yogesh Niturkar sir. He is a homeopathic consultant at Mathura Homeopathic Clinic, Latur, Maharashtra. He is a chief associated editor at the Homeopathic Heritage. He is associate editor at International Journal of Homeopathy. He is a former associate editor at National Journal of Homeopathy. He is author of 120 homeopathic articles and he is a book editor too. So he's a representative of Vital Informer. He is a life member of IIHP and HMAI. He is a member of Scientific and Education Mission Committee at IIHP. He is alumni from Dr. M.L. Dhawale Memorial Homeopathic Institute, Palghar, and he is associate professor in the Department of Organon of Medicine and Homeopathic Philosophy at VK Homeopathic Medical College and Hospital, Latur. So we welcome you, sir, for this session, and we all are eagerly waiting to hear you.
Thank you very much for a warm introduction. Shall we start?
Sure, sir.
Just a minute. So, is my screen visible to one and all?
Absolutely, sir.
Okay. First of all, before we start the proceedings of this webinar, it happens to be the 3rd July, and yesterday only we had death anniversary of our founder, Samuel Hahnemann, and on the next day, we are here to give our homeopathic in the form of this webinar that All India Homeopathic Students and Youth Association had initiated, and as a part of this Homeovision 2050, I am fortunate to be here on this platform where I am going to share my learning experience regarding how much important case documentation or case reports or case records are in homeopathy. So I will be sharing few cases. Along with that, I will try to integrate the concepts that are there in the homeopathy and how we can integrate various concepts along with the cases, that is the case to concept integrated part that we are going to learn now. Already respected doctor had given a brief introduction. The whole presentation is dedicated to these three pioneers because of whom I am able to share what learning I had done throughout my journey in homeopathy. Now, as we are aware that aphorism number 83 to 104 demonstrates the guidelines regarding case taking or history taking, or what we can say as examination of a case of disease or examination of patient. These are the guidelines to physician in view of how to conduct clinical interview, so that we can arrive at the individualization where we start the process in terms of understanding the disease understanding the man in disease and trying to figure out man in health and man in disease. So this concept can be very well understood when we go in the direction of understanding the various dynamics that are there in the process of interaction between doctor and the patient, where Hahnemann had said sick person. So the physician and the sick relationship, that also is one of the very essential part when we deal with the case taking aspect, which is very crucial. This is a general diagram that we had made in terms of step 1 and step 2 for individualization of disease and individualization of patient. And these two steps talk about the totality of symptoms, where the individualization of disease and patient as a person will help us in terms of understanding the exact simillimum, where we are going to apply it in the patients or the sick individuals for the sake of cure, as mentioned in aphorism number 1 and as given in the aphorism number 2, that is the ideal cure, with the help of the various knowledges that we are requiring for arriving at this conclusion. This is the chart that we had figured out when we were working on a textbook, the practice textbook of practice of medicine. In that this
Sorry
chart,
to disturb, sir. Sorry to disturb, sir. Actually, slides are not moving, sir. Only the first slide is visible, sir.
okay. Now,
Pardon, sir. No, sir. Can you kindly click on the second slide, sir? Sir. Second slide, sir.
Is it visible now?
Yes, sir.
This one?
Yes, sir. It is visible, sir.
So should I go with just, I will try to make a full screen. If it is okay, then we will go. Otherwise, I will minimize this.
Okay, sir. Yes, sir.
Is it visible now?
It is visible, sir. We can do like this, sir. Before the slide, you kindly click on that particular slide, sir. Yes, sir.
Okay. Is it
Thank you,
visible
sir.
now?
Yes, sir. Yes, sir.
Okay. And in between, you can interrupt if the slides are not moving or not visible. Okay.
Yes, sir. Yes, sir.
I had tried to join with the other handset so that I can understand whether the things are moving. Just give me a few seconds so that I can join with other handset.
Definitely, sir. Okay, sir.
Somehow it is not working. We will continue. You can interrupt in between. Okay.
Okay, sir.
So, as the slide was not moving, now the slides are moving. So, the importance of case reports in homeopathy, a case-based approach. In this, we can understand that Hahnemann had given various guidelines pertaining to case taking, that is also known as history taking, or examination of a case of disease, or examination of patient. In these, there are guidelines that has been given to physician in terms of how to conduct clinical interview for the sake of individualization. This is the step 1 and step 2 as per the understanding that we had arrived for the sake of individualization of patient as a person. So
Sorry to interrupt, sir. The slides are not moving, sir, actually. Only the dedicated to slide is visible, sir. Now it is moving, sir.
I think
Yes,
there
sir.
is some technical glitch. So is this okay if the slide is in this way?
Okay, sir. Yes, sir.
That is okay?
Okay, sir. Yes, sir. Please continue, sir.
Okay, okay. Just a moment. So the screen is visible now?
Screen is visible, sir, but the slides are moving slow, sir, due to the technical issue, sir.
Okay, okay, okay. Now this is visible.
This is visible, sir. Organon of medicine book slide, sir.
Yes, yes. This
Yes,
is
sir.
visible.
Yes, sir.
Okay, okay. Then I will move to the next slide.
Okay,
Now,
sir.
so now many times it happens that we feel that it is only in homeopathy that we have to ask so many questions, or we feel that the sensitivity part in terms of the patient and doctor relationship, or the way in which we observe in homeopathy, it is only limited to homeopathy. And if we try to do some sort of reading, now in Hutchinson's clinical methods, we can see the how we can acquire traditional clinical skills in terms of history taking as well as the physical examination. I will just give some glimpse of page 1 and page 2, what is given in the Hutchinson's clinical methods, where the chapter 1 talks about the patient and doctor. So it is one of the attempt that how we can perceive the holistic concept through allopathic mode of case taking. So the patient word is a Latin word which talks about the sufferance, capacity to withstand pain or difficulty, and forbearance, which talks about the tolerance, patience, self-control. Now, what is the aim of medical practice? To relieve suffering. This is what Hutchison talks about. And if we try to go to our organon of medicine, the aim of physician or the mission of physician also talk about the relieving the suffering in terms of achieving cure. Then he talks about how the method. So there are two ways. The method is clinical practice so that we can achieve excellence, and this has to be done for a lifetime practice so that we can develop skills, and that can be acquired through experience, and the excellence can be acquired through the study. Now the method that is mentioned is about the diagnosis of the case. So how to diagnose the case? And that talks about the knowledge of physician. Knowledge of physician in aphorism 3 in general, and in particular about the knowledge of disease. Now approach of treatment. So again, it is one of the things that we can find out in terms of the management part or the therapeutic planning that we are having. So the knowledge of medicines. The next thing is design an appropriate scheme of management. Again, just now I mentioned the therapeutic plan in terms of how to select medicine, which medicine to be prescribed, what clinical indications are there, on what totality of symptoms we are going to prescribe, and the selection of medicine with differentiation between other medicines that are there after the reportorial references, and the materia medica differentiation. Then we go towards the selection of dose, then the repetition strategy, understanding of how we are going to select the potency also. So this is something which is again in parallel with what the allopathic school of thought has mentioned in the Hutchinson's clinical methods. So along with these things, every treatment is individualistic. In allopathy also they are mentioning that for each patient the treatment is individualistic. So individualization, the concept of individualization is there. Then it is very essential to understand each person fully as possible in view of whatever their social class is there, income or ethnic and cultural background. So here again we come across the concept of holistic care as well as the holistic concept towards the patient as a person. In PSM first chapter, you will find that there is a reference, there is a quote that patient has to be studied in toto. Another reference I would like to give, that Jocelyn, the father of diabetology, he also stressed upon that the patient needs to be studied as a whole. So again, the repetition of holistic concept comes again and again. In current scenario also, the current government is also emphasizing upon the holistic concept, where the integration of various mode of treatment is also there in view of understanding that we have to look at patient as a whole. Again, go back to aphorism number 5, where we can understand the need of going into the depths of what sort of domestic environment patient is having, what sort of social relationship he is having, the way in which he lives, the way in which he interacts with the environment. Again, the concept that we are trying to understand is in terms of the micro and macro environment in which a person day to day lives. So this talks about the totality that is given in Hutchison, that how it is integrated concept, how we are looking at these things. It talks about the integration of various concepts that are given in the modern medicine along with the comparison with the homeopathic medicine. So the next page talks about the physician's aim at first consultation. What is my aim when a patient enters into my clinic? What is my aim? First is diagnosis of disease, what it is given in Hutchison, and second is understanding the nature of the patient's perception of the problem. How he looks at the disease condition. What is his perception? What is his understanding about the disease condition? And what are the requirements for that? So the next is establishing clinical features by history taking. So this will allow us to have clinical database so that we can understand the individualistic disease, that is to say the individualization of disease or disease diagnosis, and this will help us in planning the further management of the patient as a person. Every disease is individualistic, and every person's reaction to that disease is also individualistic. Along with that, the perception that the person is having towards the disease, it is also individualistic. So for that, what is required? Again, for establishing clinical features by history taking, that is one, knowledge of disease. Second is knowledge of pattern of disease presentation, how the disease has presented, how the disease has evolved, which are the symptoms that have come first, which is the second, third, fourth, how the evolution is taking place. Our master Hahnemann has also emphasized upon the pattern of disease presentation. When we go towards understanding various materia medica, especially which are purely based upon the provings, we can find out how the symptoms have evolved. And that knowledge helps us in understanding the image, that is the how the natural disease is taking place in patient, and this helps us in view of the pattern that the disease is having. If you just give a thought on the suicidal ideation that comes in aurum on day 1, and the way in which natrum is having suicidal ideation over after few days, few weeks, few months, or few years after brooding over the problem, that talks about the two different types of reaction, where both might be having same type of disease diagnosis like major depressive disorder or just a simple depression, but the way in which they are reacting to that may be totally different. So the evolution of disease per se is very important from that point of view, how the disease is evolving. Okay. So ability to interrupt patient's clinical database in terms of symptoms and signs. Now he talks about the analysis and evaluation of symptoms and signs. Which are the disordered functions and potential causative pathologies? So which functions have been disturbed? Which are the possible pathologies that are there? Which are the causes that are there? And whether these causes belong to physical, mental, social, or a combination of these. Please take a note of this, that this is mentioned in Hutchinson's clinical methods, where the importance of physical, mental, social, or a combination of all these things have been mentioned. So what we are looking in homeopathy and what we are way in which the things have been mentioned in clinical methods written by Hutchinson or in other clinical methods also, we can be able to find out that this is so much important. Now, this is in view of what is there in homeopathic 83 to 104, and this is just a brief outline what is there in the modern medicine. Now, how these things can be applied in our day-to-day practice. So the application part of theory into practice, that is a challenging thing, because when we say that this is possible, that is possible, so we need practice of evidences. So how to perceive case receiving? The topic that we have selected is importance of case reports. Now, if you go back to Kent, if you go back to the aphorism number 104 in Organon and the lectures on homeopathic philosophy, under that the chapter on record keeping, it has always fascinated me the importance of record keeping, the way in which we are individualizing the patient as a person, the way in which we are trying to understand the miasmatic background that is there in terms of the fundamental miasm, dominant miasm, the way in which we are trying to figure out the pattern of disease presentation, the pattern of evolution of that disease, the way in which reactions are thrown by the system in view of the susceptibility that the patient is holding. And when we are analyzing all these things, evaluating all these things, or classifying the various facts that are there and the interpretations that we are doing based upon the logic, exact observation, correct interpretation, rational explanation, and the scientific construction. So all these things are integrated, and the various types of diseases that Hahnemann had mentioned in the book, the way in which the pathology is understood, the way in which the artificial disease is understood, the way in which drug proving is done, the potentization part, everything is dynamic in its own way. The part in which we are able to understand the one-sided diseases, other types of diseases. So here we have to now apply it, and that needs experience, that needs confidence, that needs hard work, that needs undertaking of various literature, reading of various literature, and it also demands certain responsibilities as a homeopathic practitioner, that how we are producing results. Why of the results? Again, I will go back to what is curable in disease and what is curative in medicine. That needs to be reflected, because as a system, every system is having some scope, along with that limitation is there. So with that due respect to the scope and limitation, and we should respect the difference that we are able to apply homeopathic principles in most of the diseases and in other type of diseases where the limitations are on the part of the nature of disease, the outcome of the disease, the immunity status of the patient as a person, So all these will matter. So we have to understand how we can do better when there is a scope and how we can explore when there is a limitation. Both ways we are having challenges in application. So let's see what we can do. Purposefully, I have selected few old cases. The emphasis is again on the importance of if I would have failed to maintain that data, again it was not possible today to present the case. If I am presenting a case which is of 2012 and it is 2025, I am able to do this because the data is preserved, the data is kept secure. So this presentation will help us in understanding importance of how we are holding data in a proper way. So this is the first case where a 20 years girl was investigated for her colicky abdominal pain, and she was diagnosed to have generalized gastritis with severe duodenitis with mesenteric lymphadenopathy. Now this is a mixed picture, two similar types of diseases and one dissimilar type of disease in terms of the same location, same pathology, and another one different location, or we can say the lymph nodes are in the abdomen only, but the way in which the immunity is involved, that has to be understood. Now the patient was having partial relief under conventional treatment from a gastroenterologist, and it happens many times that patient goes to various doctors. Unfortunately, one of our homeopathic practitioner, our one of the family member of homeopathic family treats such type of cases. Now if you see, there are two things in this case that I will let you know. Now this is the chronic presentation, the way in which the data has been organized in terms of location, sensation, modalities, and concomitants. The location, that is, as I have already mentioned, that the patient was having colicky type of pain in abdomen. That means the system that is involved is GIT. Again, abdomen, the specific region in terms of hypogastrium and left lumbar region, that is the side. Along with that pain, there is nausea, which is partially ameliorated with allopathic treatment. And as already I had mentioned, that the patient has the patient has partial relief with the ongoing conventional mode of treatment. She is also having nausea, which is aggravated by smell or thinking of food. Degree is given in terms of the colicky pain, 2 marks, nausea 2 marks, vomiting is 1, and the vomitus consist of scanty, watery inconsistency, sour eructations are there, bitter taste is there. We can find out dyspepsia, appetite and hunger has decreased, thirst has decreased, and along with that she is having lots of concomitants also: restlessness, weakness, exhaustion, anxiety about illness, aversion to noise, and company. Okay, with that we have seen that these complaints are ongoing since 2 months. The complaints are on daily basis. There is variation in the intensity from moderate to severe, and the duration usually lasts for 2 to 3 hours, and the pace or progress of disease is gradually increasing. Now she presented with these chronic complaints. Actually, she had come for acute episode. Now again, the beauty of when we are in acute and the same type of chronic complaints are there, so it is acute exacerbation of the chronic disease. So it is our duty to understand whether there is any difference in the chronic presentation and the acute presentation that is there. Now she had presented in the acute state that she is having abdominal pain. The type of pain is dull now. Earlier in chronic presentation it was colicky type of pain. Now the type of pain is dull. Nausea is as it is same, and vomiting of liquid and solid food, thirst and appetite decreased, stool normal. Weakness, exhaustion, anxious feeling. Now here the past history, when I took as the same location has been involved, I felt that I should go for acute as well as chronic presentation, and as the patient was comfortable, I had explored her from both angles. So in that view, past history was inquired, appendectomy 2 years back, and in family history, mother is having plaque psoriasis. So this is the state, that this is the data that is available. Now, as I mentioned, that there is generalized gastritis with severe duodenitis with mesenteric lymphadenopathy. Now, from where this I have taken, so that means there are some reports. And I had mentioned that the treatment is under gastroenterologist. That means I should verify the diagnosis. So I had gone through the reports. Upper GI endoscopy, it talks about the generalized gastritis with severe duodenitis. And in USG of abdomen and pelvis, there is signs of mesenteric lymphadenopathy, suggestive of mesenteric lymphadenopathy. So here we are able to find out the diagnosis in this case. Now, as I mentioned that I wanted to explore, now there are guidelines that Hahnemann had given that in acute you should take the acute totality, and it is the liberty of physician to inquire if the patient is comfortable. Now in acute, as the location is same, so I explored the chronic as the patient was comfortable. Otherwise, again we are having opportunity to call patient after 3-4 days after the acute gets settled, and at that moment we can go for a chronic case taking. But again I am saying that the patient was comfortable, so I explored from that point of view. So as mentioned in the earlier complaints, the appetite and thirst has been decreased since illness. In terms of cravings and aversions, nothing specific. Stool since childhood. Unsatisfactory hard stools are there. Constipation needs lots of straining. Sleep is normal, but dreams are there. The dreams are of frightful nature. Now, when I had inquired at that time that what is the content of the dream, she said that I just wake up with some sort of fright. The dreams are in the way, and the dreams are unremembered. So only frightful had been taken. So since 13 years, her cycles had started, and the menstrual cycles are irregular. The flow is scanty and watery. She said it is like too thin, and it is very watery in consistency, and the thermal state is of chilly. So this is patient as a person at physical general level. Life space investigations. She belongs to a middle class nuclear family, and she shares good IPR, means interpersonal relationship, with all. Intellectually, she is average and inclined more towards arts and crafts. She had made drawing of many portraits which consisted of nature, imaginary world, abstract concepts, etc. And she had won many awards in drawing at school, college, and state level competitions. The another thing is about the sensitivity part. She is sensitive to pain or suffering of others, animals, and injustice happening to others. This was the thing that she had mentioned. This is the summary part of the whole life space investigation. And since illness, she feels exhausted. She is having aversion to noise, company, and she had developed anxiety about her illness. Obviously, a young girl can have such type of anxiety when this type of diagnosis is there. Again, it talks about the sensitivity of that individual, and because of that sensitivity, she is also feeling anxiety about her illness, what will happen. And most important thing, that she is having fear of unknown bad thing that may occur to or about her. Because of the illness, she is having this kind of feeling, this kind of fear of unknown bad things or misfortune may take place because of the type of the disease that she is suffering at a young age. Now the examination findings. Lean, exhausted look, vitals are normal, for abdomen, left lumbar region, tenderness is there. I hope all of you are with me and the picture is getting clearer in terms of how the case has been taken, how the symptomatology has been evolved. Now the synopsis part of this case, as I have mentioned earlier also, that this is the acute presentation in which patient had brought to me. So acute exacerbation of chronic complaints is there. The fundamental miasm, mother is having plaque psoriasis, patient is having appendicitis. So the involvement of location, the type of diseases that are there, understanding of the miasm, where the functional disturbance of skin, the autoimmune response that has been generated, and the functional disturbance that has taken place, in view of that SORA. And when we talk about the inflammation that had taken place, and because of that the surgical intervention that was needed, so it was more of a inflammation, so psychotic understanding was taken. Now the dominant miasm. So if we go to the pathological understanding, where the location of GIT, abdomen, in that stomach, duodenum, the involvement of mucous membranes, and the infection that is responsible for inflammation and irritation of the abdominal mucosal lining, the H. pylori infection, that leading to functional disturbance in the GIT system. So the pathology of inflammation, the functional disturbances, and the nature of disease that is reversible. So structural reversible changes that had taken place. And the most of the complaints in terms of the type of pain that she is having, more of a low or 1 grade symptomatology, but at mind level she is having that hypersensitivity. So in the acute presentation, we had considered that we should, the overall understanding of the case, the synopsis of this case, the susceptibility to be moderate and to go cautiously with potency 200, as again what we had learned, the Keynes understanding of going towards moderate potency. So repetition strategy was for acute frequently and in chronic infrequently. There are two things. The case can be viewed, the totality can be viewed in reportorial and non-reportorial approach also. Because if my learned colleagues go through the acute presentation, it is very easy to figure it out that we can think about remedies like arsal or naxomica. Okay. So as per the BBCR, as I had chosen this repertory for the totality, we can see the sensation and complaints in general, that is of inflammation, the GIT involvement. Other thing was thirstlessness, appetite want of, general weakness, nausea, anxiety with, and the eating after aggravation. So this led to the few of the remedies like Arsalb, Naxomica, Sepia, Belladonna, Calcarea. So on this basis, the three underlying remedies, namely Arsalb, Naxomica, and phosphorus. Just remember these three remedies. All of the three remedies are acute as well as chronic also. Okay, and now they are indicated in the acute presentation. As whole of the remedy, whole of the totality was covered by ourselves. Ourselves 203 pills QDS for 3 days was given. Plant diet with lots of fluid intake that was advised, and as she was constipated, high fiber content in small quantities was advised. Now, when we have taken acute totality, now we are having chronic totality also with us. The intention was taking acute as well as chronic case taking was this, to understand the remedy relationship. So earlier I have mentioned that phosphorus, arsenic, naxomica. So again, in chronic totality, we are able to find out phosphorus stands 1, arsenic, naxomica. These are the three closely coming up remedies. As they were reflected in acute picture, and when I had done the chronic repertorization for the chronic complaints, at that time I was able to find out that again the three remedies are coming. The symptom that I had taken was for chronic: sensitive, mental, oversensitive, emotional, anxiety, general diseases about, fear, general misfortune of, aversion to noise, company, general aversion to, artistic, general aptitude, frightful dreams, menses, general scanty watery, constipation in general. Now, the way in which the totality had been organized is from the point of view of emotions, then the intellect part, then the behavior part, then the subconscious, that is in the view of dreams, then the physical generals. Okay, so that led to these three closely coming remedies: phosphorus, arsenic, and naxomica. Now, as a learner, many times it happens, if only we remain practitioner, we don't go back and we, or it is not a means you don't take it otherwise, but many times it happens in practice that every time we don't go to understanding everything in more details, but it should be made a thumb rule that we should repeatedly visit to various materia medicas, various repertories, so that we can understand these aspects which our pioneers have mentioned in their literature, in their experiential writings. So the remedy relationship that will come across in terms of the acute and the chronic remedies. Now, if you see the arsenic and the relationship with phosphorus as well as with naxomica. Acute remedy, arsal. I think someone's mic is on. So acute remedy, arsal, ars and phosphorus are complementary to each other. They follow well each other. They are having comparison between them, and they are similar to each other. Whereas the three remedies, arsal, naxomica, and phosphorus, they are having relationship at two levels that is similar to each other, and that is the reason that they are coming up prominently. They are standing prominently in the chronic totality, especially, and they follow well. Arsal and naxomica, they are having good comparison between them. So for the final selection, I just, if you go back again to this presentation, the phosphorus is covering 17/9, and this is one symptom: female menses, general scanty watery. Phosphorus is the remedy that covers this watery menses. It is the only one remedy. You can see that when I went to further understanding of the symptom and to figure it out whether there are any other remedies that are covering this, So female menses general scanty watery. Phosphorus is the only remedy. So this was taken as the eliminating symptom. Eliminating symptom, all of you are aware about that. The symptom that eliminates the closely coming remedies. So it acts as a filter so that the remedial selection becomes easier. So that had been done. And if you see, with this understanding, now the next part comes is remedy response evaluation. Patient comes, we take the case, we record few of the details, we come to understanding, we come to the understanding of patient as a person, come to the understanding of disease diagnosis, and we come to the understanding of the remedy. We give it. The next step is we have to analyze what our medicine will do, what I am expecting from my medicine, what are the results that I am expecting, and how my actions are undertaken, whether it is in first prescription, second prescription, and the consecutive prescriptions. So for that, this remedy response evaluation, which we do as a part of our regular activity since our PG training at Dr. M.L. Dhole Memorial Homeopathic Institute, Palghar. So it has been something which is a ritual that we do, not as a part of formality, but in view of understanding and trying to build up evidence that how things are changing, how the response is generated, how the susceptibility, how the clinical thinking or the disease progression or direction is taking place, and what action I am expecting. And if there are some deviations, I should know why I am deviating. It is not that this remedy is not working, so I should change the remedy. So why this remedy is not working? So whether there are obstacles at the part of the patient or there are certain errors on the part of physician. So I should have a clarity as a learner. So for that, we should have this understanding in 1, 2, 3 follow-up analysis. So from that point of view, you can see the date follow-up analysis in the view of subjective distress, generals, new symptoms, interpretation, whatever follow-up has been there, we have to interpret it at the level of susceptibility, reaction, sensitivity, at the level of clinical thinking that we had done, action, expectations, and the reasons for deviations. This gives clarity to the physician. This gives insight to the physician that how I am acting in view of dealing with the patient. So on first, as I had mentioned, the ARSALP 200 was given as a part of acute. Now what expectation I am having with ARSALP? That it should be ameliorated. So I am clear because I had worked on that. It is not something which we have not taken into due consideration and we are prescribing, but we have worked on. We had selected ourselves on certain understanding of the remedy, understanding of the totality, and we are expecting that amelioration should be there. So after a few days, amelioration for 2 days was there, and recurrence of acute complaints was. This was the report from the patient. Generals have been improved. There are no new symptoms. So what is the follow-up? Amelioration for 2 days, recurrence of acute complaints. Generals are ameliorated. That means appetite, thirst has been improved, and there are no new symptoms. Symptoms are the way in which earlier had been presented. It means our medicine had acted, and with this pathology, with this diagnosis, it will take some time also. So with that, partial satisfaction of susceptibility, it needs repetition of same medicine with increased potency. So the clinical thinking remains same. I'm not expecting the inflammation should go within 3-4 days at this pathological state. So I prescribed ourselves 1M3 pills QDS for 3 days with again expectation of that acute disease should ameliorated. And overall, now she had responded to our acute medicine in a moderate dose. We are giving it now in a higher potency. Generals are improving. That is one of the best sure shot sign that the patient is responding to the treatment. Medicine had registered, and now I am saying that patient should be better within 3-4 months. Reasons for deviation, again, partial amelioration with return of acute complaints. Okay, 200 was able to take care of this susceptibility for 2 days, but on the third day, recurrence was there. So there is partial amelioration with return of acute complaints, hence the change in potency from 200 to 1M. So within 5 days, the subjective distress has ameliorated. Patient is much better. There is improvement. Again, there is increase in the improvement in the appetite, thirst, and the generals that are there. New symptom was there now, and the new symptom was congestion in chest. I said, okay, now the susceptibility, reaction, sensitivity, again, these things are in a better condition, and the clinical thinking is same, and it demands administration of a constitutional medicine, single dose, and again 200 as the understanding of moderate susceptibility and the way in which the response had been generated to the acute moderate disease, acute moderate medicine that we had prescribed. And the expectation is that amelioration of chronic complaint should be there and the frequency of acute complaint should be decreased. And the reason for deviation from Arsalb 1M to phosphorus 200 was the acute remedy to complemented by chronic remedy. So again, here we are trying to understand the way in which the remedy relationship has to be understood and how the way the complement has to be given to the acute by prescribing chronic remedy in disease where the pathology is of chronic nature. So after 1 month, within 1 month, with this prescription of phosphorus 200 for one dose at bedtime weekly for 4 weeks, that means phosphorus 4 doses in a month. Patient came after 1 month, approximately 3 weeks we can say. She had 2 acute episodes in this gap or this type of 3 weeks. Earlier, if you go back to the chronic presentation, the frequency was continuous, and here we are able to find out that she has only 2 episodes. Generals remain same, better. The congestion in chest had gone. There is no congestion now. The understanding of clinical diagnosis or thinking remains the same. Phosphorus 200, again it was given for 4 weeks with expectation that phosphorus 200 weekly single dose is acting at general and pathological level. Same 200 potency should be prescribed as it will act, so that we can be able to figure it out, the reduction in the frequency and intensity of acute complaints. So all these things are very essential from understanding the way in which our medicines are acting. So after 1 month, one mild intensity of acute was there. Overall, she is much better. Again, same pattern had given, and I had given Arsalb 1M as a stock medicine as the acutes were coming, whether they were of mild intensity, but patient should not be suffered. So she should not suffer, so I had given that. And again, same type of, there were no acute in another month. Patient was better. I repeated the same medicine. Now the question might come that when the generals are better, there is no acute episode, the complaints are ameliorated, then what we are or why we are repeating the constitutional medicine. Now here the structural alteration had taken place in the form of inflammation. Patient is better with the medicine. Now if we stop at such instances, we can keep patient on placebo, that is one way, or we can think of that, let the medicine continue so that the disease remains in control. Again, the view in view of the oversensitivity of patient, the medicine is taking care of the pathology. So this is one of the view that I had kept at that time. Now it is tendency of patients to remain without medicine once they feel better. Unless and until the next acute comes up, they won't return. So the last follow-up was on 10th of January 2013, and for 2 months patient was absent, approximately 2 or 3 months. No subjective distress, generals were normal, there were no new symptoms, susceptibility reaction normal, no complaints, clinical thinking, disease direction, everything has now ameliorated. Action that I had taken was no treatment. Now this no treatment was in view of that probable in some time she may come up with acute complaints also. But father was not in favor of taking medicine as there were no symptom at all. This is a common practice that most of the patient or the family members practice. Once the patient feels better, they are reluctant to continue with the treatment. So again, after a gap of 3 months, there was mild subjective distress. Okay. Menses were irregular. Now this is the thing that came up at the general level. Susceptibility understanding at the time was of moderate, and the clinical thinking was relapse of chronic disease. That means the disease has not been totally cured, as absence of symptoms cannot be considered only short sign, especially when there is a pathological progression where we need evidence of the amelioration of the whole disease in view of the investigations. So at that time I prescribed again phosphorus 200, 1 packet HS at bedtime for 4 weeks, and I had advised endoscopy, GI endoscopy or barium meal follow through and the USG optomy, with expectation that the medicine that I had given, it should ameliorate. They took the medicine for 4 weeks with a promise that they will do the investigation, and for this period patient has not consumed a single allopathic medicine during this whole whatever 6-7 months of treatment was there. So they did the investigation, barium meal follow through, where the mucosa of stomach and duodenum is normal. Barium meal follow through within normal limits. So the next EVG of abdomen, normal findings. Absolutely nothing was seen in terms of the abnormality. Normal findings were there, and the follow-up that at that time when they had shown me the report, there were no complaints, treatment was not there, and the patient was advised to report SOS. So all these things were possible only because of the data where we had recorded things in a proper way. Patient has visited on 30th of September 2012. So 1, 2, 3, hardly 6 or hardly 9 months, patient had responded and patient was better. So this was possible only because of the case taking that I had. So should I continue with the second case?
Yes, sir. Yes.
Okay, okay. So again 2012, now we are in 2020 after 8 years. Okay, so this happens to be a case of a 40 years of businessman from a Marwadi community who was under homeopathic treatment for his chronic allergic rhinitis. Constitutionally, he is a calcarea carb individual. He is on 200 single weekly dose for his chronic allergic rhinitis. And he called me and informed that one new case of corona has been found in his next colony. He said in that way, डॉक्टर एक कोरोना का केस हमारे मोहल्ले में हुआ है. That is why I used the corona word. Since then he had fear of contracting COVID-19 disease. He is anxious about his 6 months old son. He explained that anxiety is felt in and around chest. What he felt? He felt anxiety is in and around the chest. Now what has happened here? A person who is taking treatment for chronic allergic rhinitis at the level of constitution, he is on calcarea carb 200 single dose. At the time of COVID-19, many had this kind of fear, and out of that fear, the way their family environment is there, the intensity of fear had a variable expression. And this individual who is having 6 months old son explained about the fear and the anxiety. Now the way in which we can all relate to these things, the way in which he was worried about what will happen if the family contracts the disease. He also complained of 2 to 3 loose motions in small quantities with generalized weakness and exhausted feeling. Now there is time to apply the theory into practice, where Hahnemann had mentioned in aphorism 86, when the narrators have finished what they would say of their own accord, the physician then reverts to each particular symptom and elicits more precise information. Now what we are expecting in this, when we are talking about the more precise information, let's see what kind of question the physician asks. The precise and specific question was in this way: have you taken homeopathic medicine yourself? Because he was already oriented about the homeopathy, he was already taking treatment, and the way in which Arsal prescription was randomly done at that time, and the way in which the patients took multiple doses of Arsal. So he said that, yes, doctor, I have taken it. Our Maheshwari community had distributed it. On inquiry, he mentioned that 4 days back he had taken Arsal 30 dose for the third time. First from physician, I had insisted to tell me the whole thing. First time from the physician, second time on its own from medical store, and third time from the Maheshwari community. So these are the 3 times when he had taken the Arsal medicine. Now, if you go to the relevant points from the history, that there is a fear of contracting COVID-19 disease, anxiety about his 6 months old son, anxiety that is felt in and around the chest, and the worried about what will happen if the family contracts the disease. And the last thing, the conclusive part, unnecessary repetitions of Arsal 30 and symptoms have been developed after 4 days of Arsal consumption. He also reported to have the 2 to 3 loose motions in small quantities with generalized weakness and exhausted. Okay, so quick assessment was done in terms of the problem definition, that what is the problem in this case, history of Arsal 30 consumption, and after that on day 4, symptoms of proving susceptible to contract disease, the perception that he had. Now we are aware that when you are in a healthy condition, when there is no disease, you are better, you are not having any acute disease or acute condition, or the disease where the functional symptoms were there and now they are absent. In such cases or at such instances, if you are taking homeopathic medicine unnecessarily in a healthy condition of mind and body, definitely if you are susceptible to the potency that has been given, and that too in frequent stimulations, probability of developing symptomatology is there. So if you try to understand the evolution of the pathology, which started with functional having sudden onset, the expressions that are there are of sura, fear of impending diseases, the emotion part, anxiety, again emotion part, the psychosomatic effect, diarrhea, and the weakness that is there, which is secondary to diarrhea. So I thought that this person had gone into drug proving of ourselves, which has produced acute state of apprehension. So there is a need to go for a second prescription, that is antidote. In earlier case, we had seen ourselves having role in terms of the pathological state, and in that too acute, and the remedy relationship that it shares with the chronic remedy. Now again we are able to see the other side of ourselves. Earlier was a disease condition and the symptom similarity was there, so there was similarity in natural disease and the artificial disease, that is the drug disease. So based upon that, the similimum was ourselves and it worked in different potencies. Now here we are able to see that the potency means earlier case 201 m we had seen, now we are seeing the effect of 30 potency, where the quantity of medicinal substance is more and the qualitative part of the medicine is less. So here the acute state of apprehension has produced. So I confirmed this with the basis of that we should not go by our own prejudices. I made a short study of that case at that time and just figured it out what is there. So the symptoms that are there are of fear, phobia, disease impending of, anxiety related to the family, anxiety felt in the chest in and around, anxiety general diarrhea from, diarrhea was also there, and the weakness general, low vitality, exhaustion, arsal calcarea. Again the chronic is next to the acute one. Arsal is the acute remedy that, or the current remedy that is coming up with this totality that the patient has presented, and the next thing that is coming in front of us is calcarea. Okay, and we know the relationship between arsal, calcarea, the other remedies that are mentioned in terms of the phosphorus. So again I am fascinated to go through the remedy relationship part. Again we are able to find out, followed well by Naxomika, again calcarea as the constitutional, again arsalbis follows well by calcarea, Naxomika. It is similar, again calcarea, Naxomika are similar. So the relationship that arsalb is holding, arsenic is holding with our universal antidote, Naxomika, that we see in such cases where we are intended to prescribe antidote. So Naxomika, calcarea, both were studied in relationship with the arsal. And another thing that the antidoted by camphor, Naxomika. So again the two remedies that came up. So I went into further filtration of these two remedies. I specifically ruled out, figured it out that how they are covering the totality. If we see Naxomika, camphor, 7/5, 6/5, both of them are covering three symptoms. Okay, fear, phobia, disease impending. Now, anxiety about family is not covered by both remedies. Anxiety which is felt in the chest, that is covered by both remedies. And general diarrhea, that is covered only by camphor, whereas weakness is covered by both remedies. Now, the symptom number 3 and 5, both are covered, whereas the most important part, the fear, because everything has been generated out of this fear that something will happen to me, some disease will be contracted, and this is one of the prominent fear that the Arsalb is also having. But in this totality right now, the Nakshamika, which is covering up the symptom, and as per the hierarchy, the prominent symptom, the emotional symptom, because of which the other emotion is generated in view of the anxiety towards family. So underlying primary emotion is fear, that has further precipitated anxiety. And the last symptom of, because of the diarrhea, we can say, because of the overall impact, the emotional draining that has taken place, and that has resulted into the low vitality or the weakness that is there. So I decided that I should go with Nakshamika 200 single stat dose, so that the whatever effect Arsalb has done to this individual should be nullified. The remedy response evaluation form, as I had mentioned earlier also, and the follow-up consult. Patient on his own called up after 1 hour and said he is feeling little bit better. The anxiety has reduced. Next day, the anxiety was ameliorated. The sense of well-being was there. SWB stands for sense for well-being. That was there. Stools were normal. Weakness was absent, and he was restored to health. So I had advised him to report SOS. Treatment of SL2 pills was given so that he can have a psychological relief, psychological comfort. For that, I had given Saclec pills, and I had assured that nothing will happen to you. And this talks about the demonstration of history in view of telehomeopathy, the problem definition, problem resolution, and the interview plan that we are having. So this was the case, a short case, where we had seen how the unnecessary repetition can produce symptoms that are related to the same remedy, same medicine. This case was published in Journal of Integrated Standardized Homeopathy, incorporating Hahnemannian principles in the practice of telehomeopathy, current scenario and future possibilities. I had published 2-3 papers on telehomeopathy. I had done a small part of that, and now I will go towards one more understanding of the literature that was available. A comparison of Arsalb, nitric acid, Hiparsalb and Nakshamika, compiled by Dr. Blackie from the lecture notes of Dr. Douglas Borland in the British Journal of Homeopathy. I just went on to study various parts of the remedies. So in Arsalb it has given how it is closely related to the what is there in the patient. I will just highlight the underlined words in the mentals. Practically, he is afraid of anything and apt to panic that something will happen. Not only fear for themselves, but for everyone connected with them. Now see the depth of this fear. Not only fear for themselves. And in this case also, we had seen fear for his personal, for himself, for his 6 months old child, for the whole of the family. Okay. Another thing he has mentioned, in Ars, impulses come under stress and work up into acute state of apprehension. See how beautifully the author had written in 1961, and we are able to see it in day-to-day practice also. that how this remedy emotionally, or how he falls victim. So under stress, what has happened? The stress was everyone had gone stress of COVID-19, and how the reaction had taken up and work up into acute state of apprehension. Sometimes can't stand it any longer, and what is the further action? It ends up into suicide. So this is the thing that has been mentioned in Douglas Borlaug. Okay. So if all of you are with me, we will complete this third case.
Sir, actually, it's a question and answer time, it seems, sir. Yes, sir.
Okay, no problem, no problem. If there are
Yes,
any
yes, sir.
questions, I would like to answer them.
Yes, sir. Respected participants, if there are any question, you can ask, sir. Yeah.
I think both the cases were not too technically difficult, or there were means I'm open for all these questions, but just a way in which I had tried to answer these intricacies of case taking, the importance of record keeping, how we can preserve the documents, how we can use it for the sake of presentation, how we can publish it, how we can learn lots of things like remedy relationship can be there, how the remedies are acting, action of medicine can be there. Various concepts that are there has been tried to focus upon, because the title itself had the title itself covered the importance of case records. So any questions? I minimize this screen so that I can see the screen.
Sure, sir. Sir, I hope the participants are clear with the cases, sir. So we will move on to the wrapping up part, sir. Yes,
Okay.
sir.
No problem. No problem.
Yes, sir.
Yeah.
Sure, sir. One more session we will have from you, sir. Definitely, sir, for the upcoming knowledge. Yes, sir.
Welcome. I am pleasure.
Yes, sir. So we would like to thank today's speaker, Dr. Yogesh, sir, for the valuable guidance and the valuable share of the knowledge. So we would like to thank all the participants for their active participation. We would like to thank for the Homeo Vision 2050 and organized by All India Homeopathy Students and Youth Association for their extensive work. So thank you all. Thank you so much. We'll be back with one more session tomorrow at the same time. Stay connected and we'll get back to you soon. Thank you all. Thank you, sir. Thank you, everyone.